Test, don't guess. We all know that. We want you to test better. Valve Dynamo is a dynamometer specifically designed for MSK healthcare. It isn't a repurposed crane gauge or an inaccurate grip measure. Push, pull, grip, and more. Plus, if that wasn't enough, its app for recording and storing the data is just brilliant. valvehealth.com/dynamo for the only measurement device you'll ever need in clinic.
Welcome to Chewing It Over with myself, Justin, and with Katie. So, Katie, what does it mean to be a generalist and how important it is to be one?
Right. Well, I guess I've only just come to terms with the fact I am a generalist. So it's taken a while. So over 30 years. So to me, what it means, sorry, I'm losing my voice. But to me, it means that you can actually address the population. So I live in a semi-rural area and I treat grandparents to grandchildren. I treat, just because someone's got Parkinson's and they've got shoulder pain, I'm not going to send them to someone else if I can deal with it. So a generalist means that you can address everything. It also means that you recognize your limitations, which is good. But it also has the problem that you suddenly realize you need to know about everything. So my thing with musculoskeletal health that makes me aware, I need to know about women's health because I'm managing women. I'm managing people having babies. I'm managing perimenopausal women. I'm managing postmenopausal women. So, I need to know a bit about that. I'm treating frailty. I'm working in the community. I'm getting older people moving. So I need to know about osteoporosis and all of that. I need to know about strength and conditioning for the whole population. So being a generalist is actually really hard work and means you know a lot about a lot of things, but perhaps just not in the depth or the speciality that I had originally thought I would probably go into. So there's rheumatology as well. You don't want to miss things. And we also have our biases. So quite a lot of physios specialize quite early. So they have their things. So like the chronic persistent pain, isn't it? And I think that's great, but it's recognizing actually, not everyone who's had pain a long time has that. They actually might have an underlying mechanical problem, or they might have a rheumatological problem that hasn't been picked up because someone's down their bias. And now's not the time to talk about unconscious bias, but we all it's always tricky, isn't it? But we all have our biases. So I try and have that broad sort of approach. And I think, as newly qualified physios, it's a great time because actually all you need to do is sit and listen to your patient. The majority of time, if you take your time to listen to them, they'll tell you what's wrong or at least give you a huge clue. And I think sometimes further down the line, we're almost worse at going, oh, yeah, that's another OA knee or, and we actually forget that whole picture. But when you're sort of grasping and you really need to learn and need to listen is a great time. And clinical mileage obviously helps. But I think enthusiasm and sometimes being young is quite good. You can tell it's been a long
100%. Well, I think you basically just summarize physiotherapy in a nutshell, because we see so many different patients in different specialties and they don't always come in that clear picture or clear box. There's always something adding onto it, into that whole person. And from what I'm hearing, it's treat the patient as a person rather than just a specific condition. You've mentioned that it took you over 30 years to realize that you are a generalist. Has it always been that case? Let's say when you first qualify, what's the landscape like and how has it changed?
I was way back in the very traditional days where you all did your rotations, which I have to say I have no regrets at all, but I also ended up doing an extended role, ESP role, wasn't it, when they first came out, and that was particularly in orthopedics. But I also set up a hematology service, so for the hemophiliac patients particularly. So I've done some different things. I've worked with some voice retraining coaching, so that's with teachers talking about voice and how to use that effectively. I've done lots of different little bits and pieces, and I think I naturally thought I'd become some wonderful guru. And then realised I'm quite average. I don't have any magical powers, which is obviously once I come to terms with that, and I still don't get the SIJ joints, and so we don't go there or discuss that. I worked out I still actually most people get better. And as I tell students when I teach them, most will, despite what you do to them. So try and check you're encouraging them to improve, because we're designed to heal. And actually, there's nothing wrong with saying, I don't need to become, some phenomenal knowledge on, and I can never remember or recite papers. So I'm just a waste of time, but I can deal with my patients, and I like people. I'm interested in people, and I like movement, and I like encouraging people to move. So I think, we're all right with that, really. It doesn't have to be complicated. I do.
Yeah, because I think the other side of the argument is there is a lot of breadth, but not a lot of depth. What are your thoughts on that, on being a generalist?
Right. So, well, if you talk to me about, I don't obviously use ultrasound imaging. So actually a majority of shoulders potentially don't need that. We know they're going to show up a rotator cuff tear. It's not going to alter my treatment. So actually, there are people who need further investigations or specialist approach, and that's absolutely fine. And it's recognizing that. But the majority don't. So especially if you're working in primary care, they don't need to go into secondary care, and they don't need further investigations, other stuff. They'll normally get better if you give them proper modalities or exercises that are relevant to them, that they do, and they understand the length of tissue recovery or the time that they need to put in the work, then most will get better. And if they're not, recognizing that and sending them on appropriately.
Yeah. So it's almost like you don't need to know that much to know that, right, this patients need specialist opinion. And being a physio, it also depends on different settings that you work in. It's also about recognition, like you said. That's quite an interesting one, because in my career, taking myself as an example, I'm fairly newly qualified. A lot of people tend to have the urge to specialize very quickly. Why is it not the case for yourself? And from your experience, would you encourage students or newly qualified physios to specialize at a later stage, or still being a generalist?
Oh gosh, I mean, again, it's every individual to their own, isn't it? But I think it's just, as long as it's absolutely fine to specialize early if that's what you want to do, but recognize the breadth. I mean, to me, that's the whole joy of physio, is that it's not just the sports stuff. It's not, that if you want it to be a variety of presentations of age groups and different approaches that you have to use as a therapist to check you're engaging with the right people at the right time. Being able to approach most things in a sensible, common sense. As I said, I don't think it's rocket science. Just approaching it, methodically, and listening and doing, in general, what that patient wants to a certain extent, with reason. Okay, then you're going to make a difference to that person. And what are we about? We're about value, quality of care to our patients. Now, it doesn't matter. So, I also run a video consultation practice. So, I'm not the hands-on, hands-off. Let's not go there at all. There's no need to, because it's about quality of care. So I do use manual therapy because a lot of my 60-plus-year-olds, actually, it really facilitates their movement and it helps them engage with their exercise program. So that's fine. But, I'm also quite happy to educate, give information without touching people, because it's quality. It's that patient going away with something that is valuable to them, that you've given them something that they understand. And whether sometimes, as we talked about, it'll be, actually, I think we need someone else to come in here because this is not responding as I'd expect. That's okay.
Yeah, fine. I think a lot of things that you've mentioned seems like it's more of principles or more of a core skills that physios need to obtain rather to specialize. Would you agree with that? So things like listening, things like understanding the expectation, understanding what they really want. These seems to be something that we already do, but we don't specifically mention it. So what I'm trying. Yeah.
Well, I think you'd be interested that it doesn't always come across from patients that they get that from everybody. Okay, so I think let's not. Those core skills are actually perhaps the things we need to spend longer on, because communication, if you're not communicating with that patient, you can know your anatomy inside out, you can do whatever, but actually if you don't understand that patient's problem to them, you're not going to get anywhere. You haven't got that therapeutic patient relationship, which actually is far more important than what you're going to do to them or they are going to do for you. Because if you haven't got that grounding, you're never going to get anywhere, however clever you are.
Yeah. Makes sense. And from your experience, like being a physio for quite some time, was there a specific instances, or if you can give any specific example that you feel like, oh, actually having some form of specialty knowledge is quite useful?
I suppose I was sort of quite embarrassed when I realized how little I knew about women's health at one point. Bearing in mind, over 50% of my patients, and probably a little bit more than that, are, women. So I always knew a bit about the antenatal, postnatal, enough to advise on back pain and things like that. But then thinking about that postmenopausal stuff, which is all quite trendy at the moment, being a lady of a certain age, and actually not. So I mean, but you can skill yourself up fairly quickly. So I have done courses on it. I'm no expert. I'm not a women's health physio, but I've done a lot of education. I'm a member of the British Menopause Society. I am a member of most things. Because I'm just horribly interested in everything. So I think it's that enthusiasm that keeps me going, and perhaps having more than just a superficial knowledge. So it would probably be unfair to say that I only have a little grasp on it. I actually quite a lot.
So being a generalist doesn't really mean that you only have a basic level of knowledge. You still need to understand the some deeper principles, and like you said, the ability to recognize certain signs and symptoms. Doesn't that make you very busy then? Because you have got a lot of things, and that might be one of the challenges being a generalist.
Yeah, so if you could solve that problem, that would be good. Yes. I mean, I think the problem is I am interested in everything. So I'm interested in rheumatology because to me that's part of MSK, and we need to be aware of that. I'm never quite sure I'm happy with patients when to refer them on, but in terms of my knowledge, I guess that's what's keeping me enthusiastic, because there's always more to learn. So, if I thought I knew it all, I probably wouldn't still be working, but there's still so much to learn, and I still love learning. So I think that's good, isn't it?
100%, which I think sums up most of the physio, because I think physio as a profession has just got that desire to learn as much as they can. And that's why, courses like this, going into webinars, CPD courses are very unique to us as a profession.
Yeah, but never underplay just that time with patients though. So it's so vital that we recognize that sitting with patients, talking with patients, following up patients, learning their experience, how they found it, how they progressed, is also hugely worthwhile, and probably more so than going on hundreds of courses. But there's always some background reading you can do. You don't have to attend courses. There's so much information out there. Which can give you a headache, really, can't it? But no, I think I quite often get comments from friends going, "Oh, I didn't know you're a women's health physio." And I said, "I'm not, but I have an interest in it because I'm a generalist." So I'm interested in it. So my bugbear at the moment is the sneeze wee. So I'm having conversations with people like that. There's no reason why I can't have that conversations, but I've got enough knowledge to have those conversations. And I think what people don't always realize is our common sense approach to problem solving is really, really valuable for patients. We see things from a different way than say a nurse who will want to just help and assist. We want to think, what can we do to solve this problem for you, to get you looking after yourself, or get you doing A, B, or C. And I think that's where we sort of differ a bit.
I think it's really interesting you said that, because that resonated with me, because when I was a student, I was sort of going through placements, and when I first qualified, I was going through rotations. And then in MSK, I was sort of like fortunate, if you may, to see a patient with, let's say, stroke. And I was able to use all of my knowledge from my neurology and strokes of rotation/placement to apply to that. Whereas if you go into specialty, sometimes you're not able to relate and grab knowledge from a different experience. Would you sort of agree with that being like the biggest?
Yeah, no, absolutely. So I've treated people with shoulder pain following a stroke, and And some people go, oh, no, so actually go to a neurophysio. Well, actually, around here, they have to travel quite far. And if they're looking at private, it's all quite expensive. And most of them know me. I also have contacts with the local neurophysios, and I'm happy to phone her up, email, or I've attended appointments with patients there. So, it's not that if it's getting too tricky, then I'm going to not hand it on or share with someone else. But usually in that first instance, we have the capabilities to assess what's going on here. What can we do for help? What do they need? And moving forwards, where are we going to go with this?
Yeah, 100%. I know we spoke a bit about like the benefits of being a generalist. Are there any downsides that you can think of or you have experienced being a generalist?
I think you lack a bit of admiration from people.
Clinically.
There's not a lot of hero worship. It's no recognition. No name in lights. It's a little bit of it's a sad past. But in terms of professionally, I find it hugely rewarding.
Fair enough. Cool. And I know that you will touch a little bit more on the topic, the benefits of being a generalist, in our first step streams on our upcoming Therapy Live. Just for the audience out there, Katie's going to come on and share some of her experience at 3:45 at the first step stream. So, Katie, is there any place that you can signpost people to find a bit more about your work, some of the stuff that you're doing at the minute?
I guess so. So I run my online company is physiofastonline.co.uk, and that's just video consultations, and we're working with Boots and a few other companies at the moment.
Oh, brilliant.
I'm on Twitter as @physioktk, and that tends to be my main, or just Katie Knapton on LinkedIn. There's not lots of us, so it's pretty easy to find. So I'm more than happy to talk to anybody or have a conversation.
Yeah, nice. And have you been on Therapy Live before, or is this your first time?
I have, and I hate to say that. Yes, I was there talking in pelvic pain.
Oh, nice. But this time being a
generalist, specialist.
And
on video consultation. Anyway, never mind. Yes, I've done a couple.
Brilliant. Fine. Good. Really, really good. So not a new face for some of our audience. Cool. Katie, thank you very much for coming on to Chewing It Over, and we hope to see you at Therapy Live.
Excellent. Thank you.
Do you know your tendinitis from your spondylitis? Below par with PMR? Know nought about gout? Rheumatology.physio is teeming with content to engage with, downloads, books, courses and more to address any gaps in your knowledge. Head to rheumatology.physio, your one-stop shop for rheumatology information.